Another report that just came out on August 19th, it basically implies that the mandates that they put out based on this two-dose vaccine were useless, that the boosters themselves wane in efficacy over time. So there is a limited limited in duration value of all of this. But again, people are still following, Dr. Bhattacharya, this original guidance on the vaccines as if they reduce transmission. But the CDC is implicitly admitting now that they don't stop transmission of the virus. That was the entire basis of the vaccine mandates, were they not? And still going on for the CMS and for healthcare facilities all over the United States and schools and colleges.
Yeah, I mean, I think that the CDC has caused untold harm by basically not actually acknowledging the scientific fact that the vaccine doesn't stop transmission. And you're absolutely right, Laura. It's the basis for all these mandates on which so many people have lost their jobs. It's absolutely destroyed confidence in public health, and I think it's also had this knock-on consequence of reducing public trust in public and other vaccines that are actually quite important for public health. I think it's a complete disaster. It's not enough just to apologize or to acknowledge wrongdoing. It's just that there needs to be a fundamental overhaul.
Well, Dr. McCullough, I mean, we have doctors, pediatricians still badgering parents every time you go in to get a checkup. Have you given your kid a vaccination? I mean, baby could be like 6 months old, and they're pressuring these parents about these vaccinations still. I mean, that's borderline malpractice in my view.
The doctors have clearly drunk the Kool-Aid on the vaccines. I think the doctors actually are a big part of the problem of this kind of negative legacy effect we've had on the failed vaccine program. Doctors really need to come in line. The CDC has basically said a vaccinated person is completely indistinguishable from an unvaccinated person.
Right.
So, we need to drop these mandates and do a thorough review of what's happened.
Or ramp up the lawsuits. Okay, Dr. Bhattacharya, Dr. McCullough, two of my absolute favorites. Thank you.